Fall sports are in full swing, which means it's time to start thinking about safety gear for your kids and, most importantly, how to prevent injuries. Joining me now is Dr. Trojian, Director of the Injury Prevention and Sports Outreach Programs at UConn Health Center. Doctor, thanks for joining me.
Thank you for having me.
So let's start off by talking about this safety gear.
Yeah.
There's so many things.
There are. I think some of the things that can protect athletes, and mouth guards in particular, are very useful. They don't always protect for concussions, but we do know they protect teeth. And dental health is very important in our athletes, and especially as they get older. So we always recommend that children playing in contact, like soccer or basketball, wear mouth guards.
And a lot of these, this equipment, I should say, not very expensive, because I didn't really know the range, and I asked you. It ranges from...
It's less than $10 for a good mouth guard, and it can be easily fitted if you follow the instructions.
Now, you mentioned concussions. There was a new concussion law that was, I believe, enacted in July.
Yeah.
Can you talk to us more about that?
There's a whole group of people who are important in this law and part of the Connecticut Concussion Task Force, the Brain Injury Association of Connecticut, and the Connecticut Interscholastic Athletic Conference. So all the people got together and spoke to two great Senator Looney and Senator Gaffey, who passed the law. And the law is that coaches get education on concussions, so when they're out there without an athletic trainer who's learned about it, they can identify concussion symptoms and get people to help, and then remove the kid, remove the athlete for the day so they can get evaluated if there's not someone there to evaluate them for a concussion.
That's important information.
It is.
Now let's talk about ACL tears.
Yeah.
I had so many, I wasn't necessarily athletic, but a lot of my friends were. And once that happens, there goes your soccer career or your football career, or, you know, so let's talk about this as being one of the most common injuries, and most importantly, how to prevent these particular injuries.
Right, it's very common, more so in women, but it does happen quite often in male athletes as well. And once you tear your ACL, having a good surgeon, you know, like the ones they have at the New England Musculoskeletal Institute, can be very helpful to restore the joint back to as close as possible. But the best way is prevention. There's a number of prevention programs out there. FIFA has one designed for soccer that can be incorporated into the warm-ups.
Speaking of warm-ups, so stretching, before, after, or both, which one is the best one to do?
It's best to warm up before exercise and then cool down. So warm-up exercises are dynamic exercises. And part of that thing that I just talked about, the FIFA, the 11, part of that is dynamic warm-up. Getting the muscles warmed up and getting them moving through their range of motion is very important.
How much time, though, are we talking about when you're warming up? About 15 minutes?
Yeah,
or?
15 to 20 minutes. You can do an injury prevention program in your warm-up. And then when you're done, then the static, or the ones that you and I probably did back in high school, where you sit down on the ground and reach and touch your toes, those are designed for after you exercise, not for beforehand.
It's funny because when you get to that point, you're so tired, you just, okay, let me get my stuff and leave, but you don't remember that that's essential.
That's essential. Your muscles are warmed up. They're most responsive to stretching at that time. So if you've got tight hamstrings, the best time is after you've finished your workout to really get the stretch in at that point.
Anything else that you want people to know as far as prevention? We talked about that, about stretching. Anything else that you see all the time and you think, oh, I wish I would have just paid attention to this?
Yeah, I think the important thing is that concussions, you know, when you've got symptoms of headache, dizziness, feeling not yourself after getting hit, not just in the head, but in the body, is very important to get seen. Don't go back out there, because then symptoms can get much, much worse. And concussions are a big problem in high school athletics.
Yes, listen to your body. Thank you for all of your advice. I appreciate it, Dr. Trojian. Thank you.
You're welcome.